98.3 हेलो एंड यू आर लिसनिंग टू 98.3 मिर्ची। आज कोई स्पेशल है मेरे साथ जिनसे हम लेंगे कुछ खास जानकारी। शी इज अ डॉक्टर एंड IVF स्पेशलिस्ट। तो कौन है मेरे साथ?
Hello everyone. I'm Dr. Shilpa Saple. I'm a fertility consultant with our fertility clinics in Mumbai. I have over 18 years of experience in fertility and reproductive medicine.
I have few questions to ask on behalf of my listeners. Okay, at what age does a woman's fertility end? When should a woman get tested for fertility?
So a woman's ovarian reserve is as such fixed at birth. And from the time she reaches a puberty, there is ovulation every month. So gradually these eggs are depleted. Okay. So after 37 years, this process is much faster. And generally after 42, there are very, very few eggs.
Okay.
So there is a decline in fertility. Now, with this background, the optimum age for conception is up to 32. And if the woman wants to delay her childbearing, it is better to get herself tested. There are many tests which are available. There is a blood marker, AMH, and you can get the ultrasound to see the number of follicles. So if the female wants to delay her pregnancy, then she should get these tests done, and there are options of freezing and preserving the eggs so that the fertility is preserved.
Okay.
One last thing about this is that the women with previous surgeries or ovarian cysts should get this thing tested earlier and not wait till the time they start.
If someone is having PCOD or PCOS complication, can she plan for a baby?
Yes, actually, polycystic ovary is a very common condition.
Okay.
And in this condition, the egg reserve is good, but the ovulation is affected. And hence, because of no ovulation, patient is not able to conceive. There are very simple medicines that the patient can take and have ovulation and can conceive. Only those who have other problems of uterus, tubes, or abnormal semen parameters in their partners may require IUI or IVF. So in PCOS, it's not only getting pregnant, but we must remember that it is the way of life, because we have other issues like obesity, cosmetic concerns, diabetes, high blood pressure, which should be taken care of throughout their lifespan.
Okay, now let's bust some myths for once and for all. Myth 1. Men with low or no sperm cannot have a child.
This is a false statement. Those with low sperm counts, which can be because of many reasons, can take medications. There are many antioxidants and vitamins which are available. But yes, if the sperm parameters don't improve, or if they're not able to get pregnant in a definite time span, which is about 3 to 6 months, then they should resort to treatment like ICSI, which is another form of IVF in which they can get pregnant easily. Also, those with no sperms in the sample, in the semen sample, can also get pregnant by testicular or retrieval of sperms. That means there is a small procedure which can be done only with a needle, and from the testes the sperm can be taken and used for the IVF process, and wife can become pregnant.
Myth number 2 is children born out of IVF treatment are abnormal or unhealthy, and IVF treatment can cause me long-term health problems.
Okay, so about IVF treatment, yes, it is a myth, and many people don't come forward for this treatment early in their infertility issues. Now, IVF treatment is a time-tested procedure. We have the first IVF baby who is over 40 years old, so there is no problem that IVF causes problems with the children or has issues. IVF does not and will not reduce your egg reserve, because in a particular month there is a fixed number of follicles or eggs which are available for the stimulation, which anyways, if IVF is not being done, these are anyways going to die and become atretic. So it's a myth that with IVF treatment your eggs are going to go low or the children are going to become affected. It's not true.
Myth number 3. My eggs will run out from having more IVF treatments.
So that, as I said, it's a myth, because the IVF treatment have the egg maturation of only those eggs which are present in this particular month or in this particular period naturally in a woman once she gets her menses. So it is not that it drains out the entire egg reserve. So it's not to be feared.
So the next myth is
IVF treatment is expensive as people think. What is your opinion on that?
Yes, so IVF is an expensive treatment because you use a lot of hormone injections which are costly, and the media and the lab conditions which are required for good healthy embryo formation. Of course, those things come at a price. But then for those patients whom this treatment is required, if you go to see, they go to multiple doctors who give them medical line of treatment, lose all their time and spend so much over a period of years that in IVF they would have easily almost tripled or quadrupled their chance of achieving pregnancy at the right time. So I wouldn't say that this treatment is expensive. It is required. This treatment should be done, and in fact, it will shut down their time to pregnancy and help them to achieve their goal of skin.
Before we end our conversation, any last message for our listeners?
Yes, sure. So I would like to share that infertility is common. Almost 1 in 6 couples will need help with their fertility issues because of the lifestyle which we are right now having, the kind of food we eat, the kind of work which we do. So please do not delay seeing a fertility doctor if you're a male or if you're a female. And if you're planning to delay your pregnancy or childbirth, then go for fertility preservation. That also has very good results. At our fertility clinics, we are a chain of IVF clinics with the best of experience, skills and treatments on scientific background research. So yes, do plan your pregnancy in time.
Thank you so much, Doctor. Bane rahiye and enjoy this next song on 98.3 Mirchi.